actually rise tonight to speak to Bill 55, especially since I didn't get to speak to Bill 54 because we ran out of time. And it's really too bad, Mr. Speaker, because I had a story about my dad that was really, really good that I really wanted to share with everybody. But you know what? Y'all missed it, so I guess that's just your loss. He was a great man, and he would have loved for me to share that story. You'll have to wait for the next super corrupt bill, I guess. So,
like this one.
Yeah, like this one. So I come from a family where my mom was a registered nurse. So I come from a family that values public health care. And I think what really challenges me with this bill, Mr. Speaker, is that it actually builds on previous bills that weaken the public health care system and start to build a private health care system. And the problem with private health care, Mr. Speaker, is that it's not free. It costs a lot of money, and it basically means that the people who have money get care, and the people who don't. Or they don't get it in as timely a fashion, or they don't get it as high a quality, or they don't get to stay in hospital for as long to recover from their surgeries. We're also debating this bill at a time in the greatest scandal of Alberta history, largely centred around health care and procurement of private surgical facilities and their contracts. Where did those private surgical facilities come from, Mr. Speaker? Turns out they came from this government in Bill 26. So it seems like we're seeing a pattern here where this government chooses to prioritize private surgical facilities, and then this bill opens the door for private hospitals. I find that gravely concerning. Not just because it weakens the public system, Mr. Speaker, but I truly do believe that public health care is the greatest gift we give each other as a society. It is one of the things that distinguishes us from the U.S. very, very clearly. Even when you talk to Americans, the one thing that they say that they think is different between Canada and the U.S. is our public health care. And I can think of a long list of reasons why we're different from the U.S., and I guess I could have shared some of those in my debate on Bill 54 too, but I didn't get to.
You got time.
It's okay. It's okay, I'll focus on this one, because this one's also a pile of garbage. So, so I want to say in this bill, there are provisions for the minister to designate hospital operators that the minister deems capable. Now, I find this language particularly concerning because the Minister of Health right now will not always be the Minister of Health. And so when we include subjective language in bills like the minister deems capable, that could mean something totally different several years from now when we have a different Minister of Health, probably an NDP minister. But, you know, I digress. So what is the criteria that is deemed capable for a hospital operator? And how can we be sure, based on the language in this bill, that operator will not be a private person or a private entity, essentially creating a private hospital? The other part of this bill, Mr. Speaker, is that it allows for the decisions of discharge of patients from these private hospitals to not actually be coming from healthcare professionals, but be coming from the administrators of the building. Administrators in a private hospital that operates like a business may not have the best interests of the patient in mind, Mr. Speaker, and healthcare should always be about the patient. It should not be about the operator. It should not be about the business. It should be about taking care of people. This bill does not take care of people. It dismantles what is honestly our best social system. And it's disgusting. It's like, it's just really gross. So, with the current allegations of corruption, whether they're true or whether they're not, we don't know, because there's not going to be a public inquiry. There'll be all these other investigations that are quasi-good or quasi-real, and the results may or may not be public, and people may or may not testify. Anyway, with all of those current allegations, Mr. Speaker, I find it very difficult to trust this government to provide any kind of meaningful public health care that actually serves the people. But what I do think is possible is that this bill does allow for private hospital facilities, and then I start to think, well, what does that mean? Does that mean that we'll have a series of Moorish hospitals scattered around Alberta with a whole bunch of Turkish Tylenol and useless PPE and big warehouses and, a couple surgical rooms, I guess. We'll throw those in because we're related to those private surgical facilities. Is this the system that we're trying to set up to serve Albertans? I sure hope not, but it definitely makes me think about it. Bill 55 should have at least been amended to ensure private hospital operators are not permitted, and it wasn't. And I've heard the minister stand here and talk about all of the consultations that her ministry has conducted around healthcare over the last year, and that is true. And I have attended those consultations in my riding, and this idea of privatized hospital operators was not consulted on. The idea of refocusing healthcare into 4 different buckets was also not consulted on. So it's pretty difficult and a little bit jarring for me to sit here and listen to the minister talk about the great consultation she's been doing, or her ministry has been doing, when they haven't asked the right questions. They haven't actually asked people what they think about this. They're just throwing it out there and ramming it through with time allocation, not giving us a chance to debate it, and not adequately consulting the public or healthcare professionals in the development of these pieces of legislation. Bill 30 in 2020 lowered the bar for private clinics and private surgical facilities, and now we're seeing what happens with that. Earlier today, I tabled a letter from an anesthesiologist who lives in my riding, who's being forced to work in private surgical clinics instead of working in the public system because that's where she's being directed to work. So rather than serving the public, rather than public hospitals having operating rooms that are actually operating on people, we're funneling resources towards private surgical facilities and then literally boasting about how many more surgeries they're doing. The spin, Mr. Speaker, that we have to sit through in question period, acting as if healthcare is being improved under this government's watch, kind of makes me puke in my mouth a little bit. Yeah, oh, well, just being truthful over here. The reality is, Mr. Speaker, Albertans want publicly funded and publicly delivered healthcare that meets the needs of their families and loved ones. They want accountability, honesty, and transparency, not just in healthcare, but across this government as a whole, and they're not getting it anywhere. So I guess Albertans will just have to wait until we have an NDP government who can actually deliver on accountability, honesty, and transparency, and make sure that our public healthcare system stays public.